This is the annual training on reporting abuse, neglect, misappropriation, and exploitation. It is the policy of Baptist Nursing Home and Rehabilitation Center to ensure all staff are educated on their responsibility to stop and report all types of resident abuse. It is the resident's right to be free from acts of physical, verbal, mental, or sexual abuse, as well as neglect. All Baptist employees are mandated reporters. All staff are required to immediately verbally report suspected abuse or neglect to a nursing supervisor. If you cannot reach a nursing supervisor, this may require you to physically find the supervisor in the building. A nursing supervisor is defined as an RN or LPN that is in charge or in an administration role, such as the director of nursing and assistant director of nursing. Supervisors are responsible for immediately notifying nursing administration and the nursing home administrator for any investigations. The following incident categories are required to be reported to the Department of Health: abuse, mistreatment, and neglect, suspected medication error/drug diversion, resident burns, attempted resident suicide or death or injury related to suicide, restraints, equipment, or death related to falls, accidents related to choking, resident found in non-resident areas, CPR concerns or issues, or elopement. Any accused staff members suspected of resident abuse or who fail to follow a resident care plan with or without injury will need to be sent home immediately by the RN supervisor pending the investigation. Accused staff members are required to provide their written statement before punching out. All staff members working during the incident on the unit will need to provide immediate written statements, even if it was not witnessed. RN supervisor is required to complete an incident and accident report and notify administration. Abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, mental anguish, or denial of goods or services necessary to maintain physical, mental, and psychosocial well-being. Abuse could be resident to resident, staff to resident, family/visitor to resident. Forms of abuse include verbal, sexual, misappropriation of resident property, physical, mental, neglect, involuntary seclusion, exploitation, or injuries of unknown origin. Verbal abuse can be threat or physical action, including threatening gestures, intimidation, or fear, yelling at a resident, using an aggressive tone, belittling, or being demeaning to a resident, use of foul, threatening, disparaging, or derogatory language. After or during the incident, there is evidence of psychological harm. An example would be resident crying or shaking. Examples of verbal abuse cases. Example number 1. A resident meets with the facility social worker and states that one staff member has continually spoken to the resident in a derogatory way during the course of daily care and remains upset about it. Is this reportable to the supervisor? Yes, the scenario meets the definition of verbal abuse. Example 2. A staff member overhears another staff member say in a loud tone to a resident, "I'm getting tired of having to come in here all the time to clean you up. Sit down and stay put," while abruptly slamming the dresser drawers. Is this reportable to the supervisor? Yes, the scenario meets the definition of verbal abuse. Sexual abuse is any non-consensual sexual contact of any type with a resident. Every staff member has the responsibility to report observations or reports of sexual/intimate behavior between residents. If observed, residents should be separated immediately and the RN supervisor should be notified. The sexual or intimate behavior will not be allowed until a thorough analysis of residents' conditions can be completed by the interdisciplinary team. Sexual or intimate behavior includes kissing on the lips, touching intimate body parts or the clothing covering intimate body parts, undressing, or sexual intercourse, as well as a verbal expression of intent for sexual or intimate behavior. Real examples of sexual abuse cases. Example number 1. Resident X came into my room and touched my breast. Are they in their room and sleeping? I don't want them coming back into my room. Is this reportable to the supervisor? Yes. The resident is expressing being touched in a non-consensual way and expressing fear of another resident. We must initiate safety measures for this resident and begin investigating immediately. Example 2. A staff member observes a male resident kissing a female resident. Both residents have dementia and cannot convey what happened. Is this reportable to the supervisor? Yes. Stop and separate the residents immediately. This is an example of a non-consensual sexual contact and must be investigated immediately. Example 3. A staff member finds a cognitively intact male resident in a cognitively intact female resident room, stroking the female's resident's leg and kissing. The female resident voiced no complaint. Is this reportable to the supervisor? Yes. Stop and separate the residents immediately. This must be investigated to determine if this is consensual. If it is not, this is considered a crime and must be reported to the police within 2 hours of the incident. The federal definition of misappropriation of property is the deliberate misplacement, exploitation, or wrongful, temporary, or permanent use of a resident's belonging or money without the resident's consent. For an example, a resident reports that the night shift staff members are using her personal cell phone for other residents without her permission. Is this reportable to the nursing supervisor? Yes, this is reportable. The resident did not give permission for use of his or her personal property by others in the facility. Physical abuse can be hitting, slapping, pinching, and kicking, controlling a resident's behavior physically, for example, placing your hand over the mouth to stop a resident from yelling, holding down a resident's arms. Real examples of physical abuse cases. Example 1. A resident is crying out in the dining room, refusing to go to bed. 3 staff members assist in transporting the resident back to their room. The resident continues to yell out and the LPN covers her hand over the resident's mouth. 2 CNAs continue to assist the LPN with the resident. Is this reportable to the nursing supervisor? Yes, this is considered physical abuse. In addition, the CNAs did not stop the abuse and did not report it immediately to the supervisor and waited till the end of the shift to report it. Both CNAs received corrective actions and the LPN reported to the DOH and Attorney General. The LPN lost their employment and their nursing license. Example 2. A resident is transferred from her wheelchair to her bed with 1 CNA independently with no gait belt. The resident care plan states to assist with gait belt. The CNA successfully transfers the resident into the bed. However, the resident sustains a skin tear to her calf. Is this reportable to the supervisor? Yes, the CNA did not follow the resident care plan. The CNA was sent home pending investigation and was reported to Department of Health. Mental abuse. The use of behaviors intended to humiliate, harass, threaten punishment, produce fear, or deprive the resident. Mental abuse can also include the use of equipment to take, keep, or distribute photographs or recordings that are demeaning and humiliating. Taking photographs or recordings of a resident or his or her private space without the resident or resident's representative's written consent is a violation of the resident's right to privacy and confidentiality. Do not allow families to take pictures if other residents could appear in the photos. Kindly explain to family members that it is against regulations to take photographs when other residents could appear in the pictures. Please redirect them to an area that is more private. The definition of neglect is the failure of the facility, its employees, or service providers to provide goods and services to a resident necessary to avoid physical harm, pain, mental anguish, or emotional distress. Neglect also includes failure to carry out physician orders, delay in medication or treatment, failure to follow the care plan, and failure to provide emergency services. Not reading or following the resident care plan when providing care carries significant risks and is also considered neglect. These risks include, but are not limited to, resident injury or staff injury, investigation of the staff member involved by the Department of Health, investigation of the staff member involved by the Attorney General, loss of certification or licensure, notification to Education Bureau with the potential to not be allowed to work in any state, loss of employment, personal lawsuit by family or resident. Real examples of neglect cases. Example 1. A resident requires a mechanical lift for transfers. 2 staff members are available to transfer the resident without the lift. The resident falls. The lift was available, but the staff were in a hurry and chose not to use it. Is this reportable to the supervisor? Yes. The staff failed to follow the resident's care plan requiring a mechanical lift. Both staff members would be reported to the Department of Health for further penalties, including possibility reporting to the Attorney General. Example 2. A staff member leaves a resident on the toilet or the bedpan alone and does not read the resident care plan behind the door stating, "Do not leave resident alone on the toilet." Staff member goes to get wash clothes, answers a call light, then returns to the room to find the resident on her knees. Is this reportable to the supervisor? Yes. The staff member failed to follow the resident's care plan. This would be reported to the Department of Health, and the staff member could face corrective action up to and including termination. More examples of neglect cases. A staff member enters a resident's room without reading the resident care plan. Unknowingly, the resident's bed mobility transfer status changed from 1 CNA to 2 CNAs. The resident unexpectedly rolls out of bed. Is this reportable to the supervisor? Yes. The staff member neglected to read the resident care plan and transferred the resident against the plan of care. Example date. A staff member does not read the resident's meal ticket. The resident is on a ground diet and is served irregular meat. The resident starts choking and the Heimlich maneuver must be initiated. Is this reportable to the supervisor? Yes. The staff member neglected to read the meal ticket and the resident was served food that is not of the right consistency. This is reportable to the Department of Health. Any nursing staff member who fails to follow the resident care plan a total of 2 times with or without resident injury during employment will face possibility of losing certification or licensure and loss of employment. These are Department of Health guidelines. Involuntary seclusion is defined as separation of a resident from other residents or from his or her room or confinement to his or her room with or without roommates against the resident's will. Emergency or short-term monitored separation from other residents will not be considered involuntary seclusion and may be permitted if used for a limited period of time as a therapeutic intervention to reduce agitation until professional staff can develop a plan of care to meet the resident's needs. Exploitation is defined as unfair treatment or use of a resident or taking advantage of a resident for personal gain through the use of manipulation, intimidation, threats, or coercion. An injury should be classified as an injury of unknown origin when both of the following conditions are met. The source of the injury was not observed by any person, or the source of the injury could not be explained by the resident. The injury is suspicious because of the extent of the injury or the location of the injury. It is an area not vulnerable to trauma, the number of injuries observed at one particular point in time, or the incident of injuries over time. Recognizing the signs of potential abuse. Argument or tension between caregiver and resident, sudden changes in personality or behavior, nervousness or fear of others, agitation, apathy, withdrawal, easily startled, backing away, rocking motions, dehydration or malnutrition, or overuse of chemical restraints. Other signs of potential abuse include various stages of bruising on the upper arms, bite marks, restraint marks, dirty, unbathed, poor oral hygiene or foul odors, bruising around the genitalia, vaginal or anal bleeding. What to do if a resident reports abuse to you? If a resident reports to you that they feel uncomfortable with a situation that occurs with a staff member, family member, or visitor, this is considered suspected abuse and needs to be reported and investigated immediately. Examples of this. Example 1. Staff member was rough with me during care. Example 2. Staff member X yelled at me and made me cry. I couldn't sleep all night after this. Example C. I don't feel comfortable with staff member X providing care for me anymore. Staff member X rushed me and was very abrupt while putting my clothes on. Example D. Staff member X spoke to me in a loud and abrupt tone and was talking to me like I was a child. Any staff member suspected of abuse will need to be sent home immediately pending investigation. They will be removed from the schedule until investigation is concluded. It is our duty to make sure that they remain free from the facility until the case can be concluded. Any person who reports abuse in good faith is protected from retaliation. Staff members are screened for prior abuse before hire. It is the responsibility of the facility to provide abuse prevention annually. It is responsibility of the employee to complete the abuse training. It is the responsibility of every employee to stop and report abuse. The below number is the New York State Nursing Home Hotline. The number is located by all the elevators, inside the elevators, and courtesy phones on all units. Any accused staff member suspected of resident or patient abuse will need to be sent home immediately by the supervisor to complete the investigation to determine if there was reasonable cause for reporting. If the suspected abuse involves a crime, the Elder Justice Act guidelines will be followed. After the facility completes their investigation, the employee who reported the suspected abuse will be notified of the investigation results. The investigation must be completed within 5 business days. All reports are confidential. The accused will be notified by administration or Department of Health of the decision and if suspension or termination may occur. Why is it important to immediately report? The Director of Nursing and Administrator must determine if the case is reportable to the Department of Health. The Administrator has 24 hours from the time of the incident to submit a report to the Department of Health. The Administrator has 2 hours from the time of the incident to submit a report of a suspected crime to the Department of Health and the Police Department. Any accused staff member suspected of resident verbal, sexual, physical abuse, or who failed to follow a resident care plan with or without injury will need to be sent home immediately by the RN supervisor pending an investigation and will be removed from the schedule. If you feel uncomfortable about how a resident is being treated, cared for, or spoken to, you should stop or interject in the situation, support and protect the resident, contact the RN supervisor immediately and report what you experienced, give your written statement immediately. Never leave a note for somebody regarding the incident. Never wait until the end of the shift to report. Never send an email or leave a voicemail for someone regarding the event. Never not report due to fear of repercussions by team members. Never go along with the situation. If you feel uncomfortable about how the resident is being treated, tell the person to stop, get the resident away from the person, and report. Failure to immediately report cases of potential abuse will result in further disciplinary action up to and including termination. All Baptist Health staff are mandated reporters. Populations most at risk for abuse include people that are frail or unable to defend themselves, people with sensory impairments such as sight or hearing, cognitive impairments such as intellectual disabilities or dementia, people who are unable to call for help, people who fear retaliation against staff, shame of the situation that they're in, or that they're unaware of where to seek help. Risk factor for abusers include unable to cope with stress, loss of temper easily, overwhelmed with personal or financial issues, drug or alcohol problems, or being previous abuse victims. Burnout can be a causative factor in abuse. When a caregiver or family member experiences burnout, there is little ability to cope with the stress of caregiving. Job burnout. No longer finding enjoyment from their job, often become cynical or bitter about their job. Some factors that may lead to job burnout include lack of control or an inability to influence decisions, unclear job expectations, lack of recognition, poor communications, or high work demands. Signs of burnout: chronically late getting to work, calling in sick to work frequently, complaints of feeling sick or fatigued, regularly asking to go home early, lack of energy or lack of caring, feeling guilt or helplessness. Other signs of burnout: frustrations with the job or coworkers, blaming others for mistakes, defensiveness, or being judgmental, envious for those who do enjoy their work, withdrawn or unapproachable, working harder but with fewer successes, deadlines are not met. Avoiding burnout: when you recognize these behaviors in yourself or in a coworker, it's time to ask for help. Seek support from supervisors, human resources, employee health, or our EAP company. Manage stressors that may contribute to job burnout. Evaluate your options and adjust your attitude. More ways to avoid burnout: know your limits and work within those limits. Feel comfortable with yourself and your abilities. Change the things you can and accommodate those you can't. Organize and prioritize. Develop an active outside life. Build a support system. Maintain good communication with coworkers. Get plenty of exercise and rest. Preventing behaviors. Although not always possible, there are things you can do to prevent resident behaviors. Approach the resident in a calm manner and explain what you're doing before you do it. Give clear verbal prompts. Give choices on the things residents can control, such as the channel on the TV. Give positive reinforcement for good behavior. When a resident is having a catastrophic reaction, remember the following 5 R's. Remain calm. Respond to the feeling, not the person. Reassure the person because they are also scared and frustrated as well. Remove yourself from the situation if it is safe to do so. Return at a later date and reapproach. Managing difficult behaviors. Dealing with difficult residents or behaviors can contribute to abuse. Here are some simple but not easy tips for managing difficult behaviors in residents, families, or coworkers. Move to a private area. Acknowledge your willingness to talk but not in public. Do not react. Take time to think and remain focused on identifying the resident's needs. Attack the problem, not the person. Detach your feelings you have about the person presenting the problem. Managing difficult behaviors. Communicate directly and use I statements, not you statements. Try to identify the person's needs and look for a common interest. Do not take anything personally. Do not hold on to resentment. When necessary, for help with a violent or aggressive resident, contact your supervisor. This concludes the presentation. Please complete the test. Thank you for all you do for preventing abuse and providing good care to our residents.